President Buhari urged citizens to refrain from panic, stating that it would cause more harm than good. He also praised the efforts of the Ministry of Health, the Center for Disease Control, and various state governments.
Indeed, but meanwhile, the governor of Lagos State, Babajide Sanwo-Olu, addressed the media yesterday after inspection tour of the infectious disease hospital in Yaba.
In terms of us also scaling up the advocacy and the information that we'll have, I've invited some of my fellow governors and some commissioners of health around Lagos, especially around the southwest, just so that we can explain to them where we are, what we've been doing, and for practitioners like yourselves to also come around this facility and see for themselves, what all of you are doing, and also be very appreciative of your efforts, but more importantly, to see how we can scale up right around the Federation centers like this. And like you always know, nobody can sufficiently prepare. But what I said to someone is that facilities like this are what we call redundancies. You just have to build them, and keep them, alive for events like this. We're also calling all our local government chairmen, our CDAs, our medical officers of health, our various local governments, and so we're permeating the information right down to all our various stakeholders, just so that we carry them along, we inform them where we are, and we'll also be able to let them understand the very little things that they need to take back to their communities, just as a source of confidence and assurance that government at all levels are not leaving everything to chance, and all of us are working together in a coordinated manner.
All right, 11 more people have been quarantined in Ogun State, southwest Nigeria, on account of having physical contact with the Italian carrier of the coronavirus. They include the driver who picked him up from a hotel in Ikeja and those that served him food and drink at the hotel. The Ogun State government on Saturday dismissed speculations that the taxi driver of the coronavirus patient was on the loose. There are now a total of 39 people quarantined in connection with the index case of coronavirus in the country.
Also, Nigerian health authorities have said that the Italian who tested positive for the coronavirus in Lagos, the first case in the country, has been relocated for better care. Lagos Health Commissioner Abayomi told journalists that the Italian quarantined at the infectious disease hospital in Yaba on Friday had complained of poor facilities. He has since been moved to a more comfortable, renovated facility with air conditioning.
Well, since the recorded case in Nigeria, there's also been growing concerns over arbitrary hikes in prices of protective kits and products. The Federal Competition and Consumer Protection Commission says supplies of protective apparels and hygiene products, including face masks, latex gloves, and hand sanitizers, were taking undue advantage of the rush. It urged pharmacies and department stores to stop hoarding the product. Well, joining us to discuss the coronavirus outbreak and medical care access is Dr. Chibuki Aigbe. Thank you for that. She has over 8 years in experience in clinical and non-clinical medicine. Currently the Quality Improvement Manager of Avon HMO, a role that oversees daily patient treatment outcomes, especially in chronic diseases. Thank you so much for joining us, and sorry about the meddling in your name.
That's fine.
This is a tricky virus, isn't it? You get sick and don't show symptoms. But let me start by asking, because the global advice we're hearing is that if you do suspect you have coronavirus, if you've been in contact with people who have recently come back from areas with numbers of coronavirus, or you've been in contact with anyone who has this, basically, you should self-quarantine. What exactly is self-quarantine, and how best do you self-quarantine? How do you carry this out?
So first off, I wouldn't even say self-quarantine as the big, but you must be responsible for your health and the health of the people around you. So yes, protect yourself, keep yourself away from people as much as possible, wear a face mask, and let people know around you that this is what is happening. So you can't have symptoms, which unfortunately are general symptoms like you will have for any other flu, or even the common illnesses that we suffer here in Nigeria. So, I mean, it's everybody's personal responsibility to know and identify these which like fever, headaches, a running nose, cough, a sore throat, keep yourself away from everybody. Wear a face mask. And that's why there's the undue rush for protective gear like masks, especially masks. If we all going and buy what's on the street, then when people who have been exposed need to protect themselves from infecting you, it won't be available for them to purchase.
And the Minister of State for Health was speaking this morning on a television program and said there's no need for protective face mask. Or just keep the normal precautions, move a little bit away. And the undue, need everybody going to buy protective face mask is what is causing the hike in prices and the likes. I mean, would you subscribe to what the Minister of State said? He said we shouldn't panic. There's no need for that.
Yes.
Just take appropriate steps.
Yes, there is no need to panic. But I would say that in going to crowded areas where you really can't do it, it's not possible to be 5 feet away from somebody, you might just need a face mask because you don't want anybody coughing or sneezing on you. So as far as we know right now, it's not airborne. So yes, it's in droplets. So if I cough or sneeze and the virus gets into your eyes, your nose, your mouth, then you will get it. So am I going to say, I don't want to scare anybody, but yeah, a bus stop, for example, waiting for a bus. I don't have control of how far somebody is away. And if the person wasn't responsible enough to have a face mask on, the onus is on me to protect myself. Is that not
why they say people should, cough into their cup?
Oh, yes.
Or sneeze into their cup or something like that?
I mean, unfortunately for us, this generation, we weren't taught that. But our kids are now being taught proper way to take care of yourself when you have a flu. So you cough into your elbow.
Okay, like this. Maybe let's just all do it for the sake of
so you cough into your elbow and not into your hands. Okay. Because you might not at that particular moment have the opportunity to wash your hands. So whenever you get to wash your hands, it's advisable, as WHS was, wash all the digits, okay, the palmar surface, the dorsum of your hand, and up to your elbow, in between your nails, because you might have coughed into your elbow. And then your general surfaces, contact surfaces, doorknobs and all that, as much as possible, don't touch them. This period might have to be a little germophobic. Well, do that with using your elbows, and as much as possible, use your hand sanitizers. And yes, when you have the opportunity, wash your hands.
Yeah, what about cases of people that are carriers of this virus, however, don't show symptoms? And for example, I think where that would really be a problem is at the airports because of the time in which most of these journeys take. So a carrier coming in and not necessarily having the symptoms, how do we reckon we combat that?
So as it is now, like I had mentioned, in confined spaces, say an aircraft, I can hear somebody coughing down the aisle. It'll be fair enough for me to have a face mask on. And because it's a maximum of 14 days for you to come down, it has an incubation period of 14 days for you to come down with symptoms if you had prior contact with anybody, also depending on your immunity at that state. So you can have 2 days, 3 days, and as much as 14 days. So yes, you might just, you might be able to spread the virus even when you're without symptoms.
So how deadly is coronavirus? Because I've heard terminologists, people say, oh, the deadly coronavirus. Yeah. Compare this to Ebola, because we all remember vividly what Ebola was like. How deadly is it? And what are the factors that may, help you recover or, are detrimental for you to have this? Is it due to age, the kind of health systems you have, sex? Female, male, who's more susceptible to coronavirus? So
Mother Nature can be very tricky. He has a way of balancing things out. So on the other hand, we had Ebola, which was very virulent with high mortality rates as much as 40 to 45. It wasn't so it didn't spread as much as corona is spreading. So there's a balance. So corona is very contagious, but the mortality rate is still very low. As at Saturday, mortality rate was still about 2%, 2 to 5. As of today, it's about 3.5% because mortality rate has shot up to 3,000 and about 69, out of the people who have contacted it.
Okay. So we'll go on a quick break now, Doctor, but we'll come back to talk about those factors that determine your survival for coronavirus. Stay with us. You're still watching The Morning Show here on Arise News. Join us again. Great to have you back. You're still watching The Morning Show here on Arise News, and we're talking development on coronavirus outbreak. Of course, the medical care access for this virus, Dr. Chibuki Aigbe is here with us in the studios to help us dissect this further. Thank you so much for staying with us. Before our break, we were responding to how deadly this could be, the difference between this and Ebola virus. And then I asked you a question about what are those factors that may determine your survival, the sex, race, health systems, are these the factors we should look at? And also, just to add to that, because we are all aware of Ebola. It was alien in the beginning. Even medical doctors were said not to know much about it. When it comes to corona, it is not so new here. But this strain is the first we're seeing it in humans. How well do the medical practitioners, such as yourself, know about this? And is that another factor that may determine what Nigeria does in the coming days?
So you're very correct. I'm going to go start with your second point. You're very correct. Coronavirus has been around for a while, but this is nouveau coronavirus. It's actually very new and very alien to all of us. But I'm glad that, maybe that might not come out right, but it started from a place where research is currently being done and new level of knowledge is being reached per day. So I do agree, yes, it's new and alien to us, but new advancements, new knowledge is being gained on a daily basis. Nobody's sleeping on their oars on that. In Nigeria, same thing. And what is happening is there's a global spread of knowledge. So Nigeria is doing its research. Asia is doing its research. The United Kingdom is doing its research. At the end, everybody's sharing information and knowing which way to come back, because this is a global thing as it is at the moment. So everybody's working together to make sure that new discoveries are being brought forward. And then factors. The risk factors would include extreme ages, old age, because these viruses are known to tackle your immune system. So people who have low immunity, chronic disease sufferers such as those who have diabetes, people who've had organ transplants, people who have HIV/AIDS. These are risk factors, right, that could determine your ability to recover from coronavirus infection, the COVID-19.
Okay, I just quickly want to make some distinctions. Number one, Ebola was a hemorrhagic fever. Yes. This is not a hemorrhagic fever. Yes. The way this works is quite different. I mean, some can even go as long as possible for the duration without having symptoms. Even older people. I mean, I was monitoring a story of CBC in Canada, and they interviewed people that were in quarantine, coronavirus, and they were like, I've got 2 more days to go, and they're going to do double tests, and I'm going to be over it. Another part to it I want to talk about is the part that people should build a lot of their immune system. I mean, we're not talking enough about that. The precautions to take us through, and generally building your immune system. And secondly, another part to it is, he says research is going on. President Trump was speaking on Saturday, and he said about 3-4 weeks we should get something out of this. I mean, people are working around the clock. CDC is working around the clock. There's a story that came out of Israel, correct me if I'm wrong, about a vaccine found for avian coronavirus. So a lot of work going on as regards to this, and a vaccine should be out. So what do you say to all of this?
So I unfortunately don't have that information, and I do not work with the research team on the coronavirus. I would not say to give a particular time waiting for this virus to come on, but let's be hopeful. So yes, they might look at 2 weeks, 3 days, whatever time, and it might just not come out then. And whatever trials might come out might not work as they thought it would have. I also do not sure about the getting a vaccine for the avian coronavirus. I'm honestly not too sure about that. But be rest assured that something is in the works.
I mean, you did mention about the fact that, this is a global problem, and the fact that, these countries are communicating. The Chinese government, shared a treatment protocol with Nigeria that they used to treat about 5,000 people. So should there be a level of comfort from getting these protocols from them? And secondly, for looking at the fact that we've adopted the right strategy in Nigeria to combat the coronavirus. As you rightfully mentioned, we have cases where there are just 100 people, but we have 20 people that have died from it.
So, like I think I mentioned this off air, the key to managing any outbreak is identifying the index patients, which we have done in Nigeria as it is. And we've been able to track as many as 39 people who are currently being quarantined, which is the first step, the right step in the first step in the right direction. So, yes, I know that especially the Lagos State Government and the Federal Ministry of Health working tirelessly to ensure that our own report card is not as bad as everybody's going to expect. The way we're all able to combat Ebola, everybody's working to make sure that yeah.
So make these distinctions, because with some hemorrhagic fever you hear, it cannot be cured, but you can get treated, and then there's no vaccine. What's the situation with coronavirus? Can it be cured and treated?
So it can be treated. So what happens is unfortunately, most viruses can't be cured. Only your immune system will help, already fight it. So the best thing, like you had mentioned, is to build your immune system, and everything we've been hearing back from when we were kids: eating well, exercising, your diet, being well hydrated, sleeping well, fruits, vegetables, balanced diets, yes, will build your immune system. And should you have coronavirus, in supporting all the symptoms that you come down with, your immune system is able to fight it.
All right, real quickly, what's the role of the health insurance companies as regards this? I mean, with staying with hospitals and things like that, the bill must start to accumulate and things like that. And definitely, some of your partners, people present cases as some of your partners. So is there like a special, covering for coronavirus and the likes and things like that?
So for coronavirus,
still goes on your normal HMO?
So the health insurance scheme in Nigeria is very robust. And because the symptoms of coronavirus is just like every other ailment. So we advise that should you have your fever, your running nose, your sore throat, cough, whatever, upper respiratory thing you might come up with, you present in the hospital. And we manage you as a health insurance firm, and like other health insurance firms. However, once you're diagnosed with coronavirus, we hand you over to the federal government so that we do not at any point interfere with their management, their protocols or whatever. And yes, all proper documents are.
I mean, very quickly, we're wrapping up now. Your final thoughts on this to Nigerians. How do we, you rightfully have mentioned some, but if you could just quickly, in 30 seconds, remind Nigerians what to do while dealing with the coronavirus.
Okay, now, so coronavirus is here. Really. We're always scared, and unfortunately, there's gist about weather, not being favorable, race. Studies till now haven't proven that we're protected in any form. So until that comes out, I'll employ all of us to, keep at it, having our personal hygiene, washing our hands, using our hand sanitizers, watching yourself. Should you fall ill, go to the hospital and inform the authorities that you have. There's some people also very scared to show up and come up, and they think they'll be thrown into some dungeon, or please, let's just be responsible to ourselves.
People that do self-medication in this period?
Uncle, please, let's try and desist from that. Thank you.
Thank you very much. A good place to leave it. It's also not a deadly or a death sentence as some people are, thinking it is. Thank you very much for coming on the show. That brings us to the end of the show today. I'm Adesua Omoruwan.
I'm Rafai Husseini.
And I'm Shaitan Atigari. Thank you so much for watching from Lagos Studios here. You can follow us on our social media handles showing now on the screen with live streaming on arise.tv.